Murphy Austin Adams Schoenfeld LLP, focusing on business law and commercial litigation, is proud to support Rob on the Road Region Rising. More information available at murphyaustin.com.
Coming up next on Rob at Home, she's a leader in healthcare in Northern California and the wife of a United States congressman.
At WellSpace Health, we serve the underserved. That's our mission.
Dr. Janine Bera on health disparities and the lack of access to care. Plus,
as we talk about the recovery, the immediate recovery and the relief from the coronavirus, we cannot sit idly by and just let resources go to quote unquote the usual suspects.
Sacramento Observer publisher Larry Lee on covering the crisis and caring for the community. Rob on the Road starts right now.
And now, Rob on the Road, exploring Northern California.
Hi there, it's Rob Stewart and welcome to Rob at Home. Great to be with you. Here in Northern California, we have a rich tapestry of experts in our medical community. We also have a marvelous mosaic of cultures that make up the diverse region. But among our communities are crushing health disparities, hurting generations. We're going to focus this episode on health disparities. But first, with more people out and about, a refresher on doing our part for the health of others and ourselves. Joining me now is Janine Bera with WellSpace Health. She is the Chief Medical Officer. Good to see you, Janine.
It's nice to see you too, Rob.
Janine, tell me, first of all, you have an interesting perspective. You're the Chief Medical Officer at WellSpace, and you also are married to Congressman Bera. So you have a congressman in your house.
Literally roaming around in my house.
You're hearing all types of different perspectives. Where are you right now in navigating all of this?
Well, I would say this has been one of the most unusual times in medicine and in our history, basically, because we're faced with a threat that wasn't man-made. It is something that just occurred, and we are having enormous outcomes because of it. So as we like to say, it has caused us to really build the plane while we're flying it, meaning things are happening and we're having to react to them, and we're trying as much as possible to react to them safe and sanely. Now, fortunately, we have some good guidance out there from the CDC and our state and local government, and it is wonderful because they keep things up to date so that when we have questions, we know where to go to get factual information.
Okay, we're all getting, in many different ways, either really hyper vigilant and secluded, or the opposite, and just letting go, and we're all somewhere in between. Let's do a reset. What is the reminder today that people need to do to stay safe?
We still today need to be wearing our mask. We still need to socially distance at least 6 feet apart. We still need to, and probably most importantly, wash our hands with soap and water. And we still need to remember not to shake hands and to start to, as a culture, get used to the elbow bump or just the wave, the bow, whatever you feel comfortable with. But the shaking of hands, again, is a way to pass on the virus. We still need to do all of those things so that we continue to flatten the curve and to decrease the number of people who get the virus, and then the number of people who get sick, need hospitalization, and may pass away from this virus. Following what Governor Newsom said about social distancing, hand washing, don't shake hands, and now wear masks. You know,
oh, and yours matches.
Yes, does match. So it's been kind of fun doing that now, matching your mask to your outfit, kind of making it part of your whole ensemble. Making it less unusual. I'm just incorporating it into my whole outfit.
I've also heard that if you don't wear the mask over your nose, it's like taking birth control sporadically, or you have to cover it all.
No, you really do. So the proper way to wear a mask is completely over your nose and mouth so that nothing is showing. You have seen people who do this, and like you're saying, your nose still can have respiratory droplets come out. And so that's why it's important to cover your nose and your mouth completely. I'm sure you have all been to a cocktail party or other party where you were talking closely with someone and you could actually see the droplets coming out of their mouth. And at the time, you probably just thought, oh, they're a close talker, maybe lean back a little bit. That's exactly what we're talking about. When you're talking to people, you can have microscopic or very, very tiny, so you can't see them droplets come out. And it's in those droplets that the virus would be. And then when they would land on another person, then they could become infected by, maybe they didn't land on your face or in your mouth. That sounds very gross. But maybe they just landed on your sleeve, and then I did something like this, and then I did something like this. Or like this, or I rub my nose, and now I have taken the virus and introduced it into my system because our mucous membranes, eyes, nose, mouth are the ways of avenues into our system to have us be infected.
What are you seeing that is concerning you the most?
What is concerning me the most might be some of the disparities among different racial groups, ethnicities, or socioeconomic statuses. And that is very concerning to me, but I do think that doesn't point out anything special about any particular group, other than it points out to the lack of access to care to large portions of our population. Because who gets sick with COVID is, of course, people who have other chronic diseases. Who has chronic diseases that aren't under good control? Because I should say people who tends to be people who maybe have they're not under good control are people who lack access to care. So it does point out our holes in our healthcare system, and maybe we can do improvement on them so that people's chronic diseases receive the care and preventative treatment that we know works, that we know can make a difference in a lot of people's lives. So I would say that is very concerning to me.
Now, with your position, you have an interesting insight and ability to look into those health disparities as well as the whole system. So why today are there people, heartbreakingly so, who do not have access to care?
Well, there are so many reasons for that. You know, at WellSpace Health, we serve the underserved. That's our mission. And we work with all of the wonderful medical groups out there, Kaiser, Sutter, UC Davis, Dignity, to provide outpatient preventative medicine to people before they get sick, like I was talking about, so that they have the access that they need in primary care. And
I love that, by the way. I love that that's what you do.
Oh, well, thank you.
That you serve the underserved.
And it is, we work with everyone because our patients might be hospitalized anywhere. And so we have these wonderful relationships with our community partners to serve a population that falls kind of in a gap or hole. And these are people who have medical insurance on Medi-Cal. And there are also people who are uninsured, and they could be uninsured because, and this is the part that we might see more of. There are people who, maybe it's a young person who is, 26, 27, who no longer can be on their parents' insurance, but they're the entrepreneur. They might have 2 or 3 jobs and they're making it because their focus in life is to travel or to do whatever their hobby is, and so they're making ends meet, but they don't have employer-based health insurance. It also can be the person who's working in a restaurant as a hostess or a waitress and gets most of their income on tips, and again is making an okay living, but again, no employer-based health insurance. It also can be the homeless person, the mentally ill, the person who's addicted to drugs. There's lots of categories of people who may not have insurance for a variety of reasons. The ACA or Obamacare gave each of these individuals an ability to get affordable health insurance. So as a country, as a state, we have to look at how are we going to care for what I can only imagine is going to be a growing population of our fellow Americans. We also have the undocumented. Now at WellSpace Health, we see everybody. It is our mission, and we mostly do serve in the Medi-Cal, but we are there for anyone who walks through our doors. We figure out how to, we have a sliding scale so that we can figure out what someone can afford to pay.
And I'll tell you one thing, a pandemic certainly points out health disparities all across the board.
It does.
We are all human and nobody's any different. And we all can get sick and we all can get healthy. And that should not be offered or delegated to one person or another.
No, it's not. And so that's why I'm hoping that we take this opportunity to look at how we might provide access to care in a more equitable way so that everybody has health insurance. Yes, we all, or anyone can go to the emergency room, but we don't want people to wait until they get that sick, that they have places that they can go to get the care that they need before they get sick, because we know prevention works. We know that when you get your diabetes taken care of and you're able to stay on your medicine, have regular visits with your medical provider, your likelihood of having those bad outcomes, a heart attack or stroke, is much decreased. But it's getting that information out to have people educated about that, but it's also, they have to have somewhere to go. And I'm, very proud of my organization, all the other federally qualified health centers and community health centers and free clinics out there that do this work. And also to our, the other bigger hospitals, Kaiser, UC Davis, Sutter, Mercy, who also strive to provide care in many different ways to this population. I feel very proud to work in Sacramento because we do have so many caring individuals here. It's been an honor to be in this space and to work with so many different amazing people.
You are one of those, and you're talking about this region being so great. And when I think about this region being so great, you were one of the faces that comes to mind immediately. So I thank you for that, for making us a better region, and frankly, for making us feel safer, because you stick to facts and not opinions.
Well, thank you very much. And I'm happy to be able to take this moment to talk about this. And so thanks for giving me the opportunity, because when you do think of great Sacramentans, we do think of Rob too.
But Janine, I also want to say, and thank you for that, but I do want to say, if there's anything that we all can be a voice of right now, it's something that what you stand for all the time at WellSpace Health, and that is helping those who have less than us. Because at the end of the day, I truly believe that's what matters. What have we done for people who do not have the same access to things that we do?
Exactly. And it has been heartwarming to see so many of my friends and neighbors making masks, because wearing a mask, again, says I care about my fellow man, because you're not actually wearing a mask to protect yourself. You're wearing a mask to protect others, because from what we've learned about this virus is you can have no symptoms, but be spreading the virus around. And I know of a patient like that who had absolutely no symptoms and had no symptoms but tested positive and has been out there. And so we were able to, when you get tested and you find out, then you're able to stay home. This was very early on. And so that's why I was starting to hesitate. It's like, now we have different recommendations about everything, but large part, regardless, that is the root of why you wear a mask, is to protect your fellow man.
Yes, and also protection should not be political.
Exactly.
Precaution. So thank you so much, Janine Bera, for joining us from WellSpace Health. It's a privilege to talk to you always, my friend. Thank you.
And thank you. Bye-bye.
The coronavirus crisis has brought many things to light, situations that have been going on, however, for decades. And we are talking right now about health disparities with communities in Northern California. And Larry Lee is the publisher and president of the Sacramento Observer. Larry, it's great to see you.
Thank you, Rob. It's good to see you too.
So let's talk. What are
Yeah.
you seeing right now regarding, and especially with the things you're hearing from readers and from the medical community, what are you seeing in regards to health disparities in communities of color?
Sure. Well, again, Rob, thank you so much for having me on. As you mentioned in your intro, the coronavirus has revealed to a lot of people the what we've known for many decades and generations within the African American community, that there are so many disparities that impact us. The underlining thing that you see, particularly from the African American community, while our infection rates are about on par with our demographics, the scary thing is the mortality rate for African Americans tends to be almost twice as much as our counterparts, and that's the scary part. And what is that speaking to? That's speaking to lack of access of healthcare, real discrimination within the medical system. Oftentimes African Americans go to the doctors, they say something's wrong, and the doctors sometimes shrug it off. So there's some sensitivity issues that are also a part of that. You've got the economic challenges as well too, transportation issues. So this coronavirus has really, if it has done nothing else, it has hopefully raised the awareness of the disparities and the devastating impact that many of these disparities have had, particularly on communities of color and specifically African Americans.
These disparities have been going on inexcusably too long in this country. And I hate to say this, it breaks my heart to say it, but the health disparities are not new. Unfortunately, they've been around so long. It's the awareness that could be new for some people.
Right.
And I'm curious, what does that make you feel, knowing that you've been reporting on these issues for 57 years, your paper
Sure.
has, and then they've been before that.
Right. Well, I think, I would say probably I'm an optimist, Rob. If you know me, I try to look at things as a glass half full. And while the coronavirus is tragic and very devastating, and the loss of any life is an unnecessary life is devastating. But I think what I'm hoping we can get out of this is a new understanding and a new awareness and an acceptance that we will not go back to quote unquote business as usual or as things were before. I'm hoping that through increased dialogue, awareness, and recognition that these gaps have existed and that the coronavirus has exacerbated them, that we can raise awareness of people and really dedicate, kind of create a new paradigm for our community and for those that are less fortunate. I know the Observer has been involved with discussions with both the county and the state, and the city, I should say, county and the city, in regards to how do we positively come out of this. The relief efforts are critical, really funneling financial support to assist in the recovery of our community is critical. And I think that there's awareness. So there's a healthy lifestyles conversation that has to be addressed with everything from, and that begins to start talking about the social determinants that impact healthcare. So you're talking about food deserts, you're talking about access to transportation, you're talking about access to capital and resources.
It's
so
important for me to say that healthy lifestyle, though, is not, it sounds but it's not a choice-based situation.
No,
Lifestyle
exactly.
is access.
Right, absolutely. It's completely related to access. Then you start talking about health care, right? So then you're talking about the access to, medical treatments, and now you start talking about, telemedicine, right? So then we start talking about technology and the access to technology and being able to access a doctor that can step in assistance to, or in addition to the checkups that you might have to go to, and then just even having a job that allows you to have healthcare. So there are so many things that need to be addressed. That's why I say the system literally has to be changed as we talk about the recovery, the immediate recovery and the relief from the coronavirus. We cannot um, sit idly by and just let resources go to quote unquote the usual suspects. So, the Observer has partnered with other community leaders here in this region. We submitted an open letter to all of our elected officials and county administrators and city administrators as well too, where we've been literally asking for, a change, a better sense of dialogue, a more deliberate and intentional effort to try and make sure that we are engaging our community and helping them with resources. I
Are you
think
getting any type of feedback?
so. We're getting some feedback where there have been some ongoing discussions with both the county and the city that county supervisors like Phil Cerna wrote a wonderful letter in response to it. Mayor Steinberg actually submitted a letter yesterday as well too, really trying to make sure that our community knew that these things are being addressed. But we're trying to continue to push on that, and that pressure is critical. We are not going to let our elected officials off the hook. This has to change, and it's got to come from our leadership. If you're going to be in leadership, step up and lead, and do it with courage and inclusivity and with equity as being a principal outliner.
So how do we do that? Is it that there needs to be more people at the table, so to speak? Is it something that
Yes.
we as citizens need to do? And what is that
Sure.
needs to be done to help keep this on the forefront?
This, most movements come from the ground up, right? I mean, you've got to have great leaders who are listening, and if they're not listening, then as the ground speaks, if they're not listening, then the ground has to change those leaders. And so I'm hoping that we can have sensitive and courageous leaders in our community. But I know our community level of engagement has to continue to be persistent. Oftentimes we get caught up with the emotional things, right? Whether it's, the police brutality or some other alarming disparity that riles us up and gets us involved. But these other things are impacting our community, and they have been impacting our community for generations. So there's a level of us as community folks who have to make sure that we're involved, but we don't have the access to the resources. So the resources have to come from above for sure. But we have to stay diligent and persistent with our, I guess the best word to say is agitation.
Mm-hmm. I'm curious to ask you, at the Sacramento Observer, how are things going? And you're talking about so many important issues that desperately need reporting on.
Sure.
How are things going at the Observer right now?
Well, let me just say it like this. It's an interesting time for newspapers in general, correct? I mean,
Correct. All across the board.
So the work that the Observer has been doing for the last 57 years, fortunately, is going to continue. What we did yesterday is not necessarily what we're going to do tomorrow, right? So, and that can be a good and bad thing. For some people, that can be traumatic, right? The Observer has done a certain thing for such a long time. People have grown to love and appreciate that. But I think what's part of, and the other part of that is important, is that we recognize that we're content creators, right? So we're trying to make sure that as we develop our sustainability model and change a little bit about our delivery process, that we look at ourselves as content creators and that we can help really galvanize our community in a way that will be pretty powerful. But I think we will have something pretty unique and exciting and engaging and pretty powerful. I'm very excited about it. So you're probably the first media outlet that I've said as much about what we're doing.
Then keep going. Keep telling us.
You got the scoop here with Rob, but I think it's going to be pretty exciting, and it's really hard. It's really hard. The term that I use, it's fixing the plane while you're flying it, right? Each week we produce content and stories, and we start the page with blank pages, and we've got to put quality content in there by the end of the week. And so we have to do that each and every week. But meanwhile, while we're doing that, really trying to, like I said, reimagine what we can do. And I think this community will really be excited about the things that we unveil over the next year.
Larry, thank you so much.
Thank you, Rob. I appreciate it. And call on us anytime. Thank you so much.
And likewise, if I can help you in any way, let me know.
Will do.
I believe in you. Thanks,
right.
Larry. Okay.
Take care.
Take care. Thank you. Bye-bye.
Murphy Austin Adams Schoenfeld LLP, focusing on business law and commercial litigation, is proud to support Rob on the Road, Region Rising. More information available at murphyaustin.com.